First of all, my name is Dr. Tom Wong, and I want to acknowledge that I'm on the unceded territories of the Algonquin people. Many people have asked, what is PPE? PPE stands for personal protective equipment. And in the context of COVID-19, it refers to the equipment worn to protect the individual and or those around them from the spread of the infectious disease. In a medical setting, PPE may include face shields, surgical masks, N95 respirators, gowns, gloves, and hand sanitizers. Indigenous Services Canada is supplying PPE for healthcare workers and those providing essential health services in First Nations communities to support the response to COVID-19. As of April 27th, we have shipped over 600 orders of PPE to First Nations communities across Canada. When is PPE needed? Healthcare workers need PPE to keep them safe during medical procedures and to care for individuals who have COVID-19. Due to the global shortage of PPE, it is important that we keep the supply of medical PPE for healthcare workers. There are some situations in which PPE is required by those who are not healthcare workers. One such situation is providing care for someone with COVID-19. PPE, including a medical mask, a disposable gloves, and eye protection, is needed for those providing direct care to an individual with confirmed or suspected COVID-19, including those caring for a family member who is ill. Community members may consider using homemade non-medical masks as an additional measure to protect those around them for short periods of time when physical distancing is not possible. For example, going to do grocery shopping. When worn properly, a person wearing a non-medical mask or face covering can reduce the spread of his or her own infectious respiratory droplets. The Public Health Agency of Canada has released instructions on how to make, put on, and take off a homemade mask. On the slide, you can see one of the no-sew options using an old t-shirt. There are also step-by-step instructions using a bandana and a sewing method using cotton. Face masks can become contaminated on the outside or when touched by your hands. When wearing a mask, take the following precautions to protect yourself. Avoid touching your face mask while using it. Change a cloth mask as soon as it gets damp or soiled. Non-medical masks that cannot be washed should be discarded and replaced as soon as they get damp, soiled, or crumpled. PPE alone does not prevent the spread of COVID-19. Be sure to follow the guidance of public health authorities on the best ways to stay healthy during the pandemic. Some examples of ways that you can slow the spread of COVID-19 include wash your hands often with soap and water for at least 20 seconds, or using alcohol-based hand sanitizer when water is not available. Try not to touch your eyes, nose, or mouth. Coughing and sneezing into your sleeve, not into your hands. Avoiding close contact with people who are sick and staying home when sick. Avoiding gatherings and keeping a physical distance of approximately 2 meters between each other. The Public Health Agency of Canada's guidelines on public health measures are intended to support the health of all Canadians. Hand hygiene, physical distancing, all of those are preventative measures to support the safety of communities. Communities are encouraged to implement and adapt the guidance to their own context, taking ownership of this information. Inuit Tapirit Kenatami has developed very helpful infographics such as this one, to communicate public health guidance. Other examples of the advice include send one member of the household to get groceries, keeping kids at home, protect elders by staying away, call or visit them through the window instead, provide for elders by dropping off food at the door, allow children to play only with children from within their own household. In these difficult times, stress and worry are natural reactions. To support the well-being of ourselves and those around us, consider the 3 C's. Try and remain calm. This will help support you and one another to remain content. Caring for one another is important. For example, calling a family member, use FaceTime. There is a great deal of information out there about COVID-19. To ensure that you are getting information from reliable sources, check out the Indigenous Services Canada, Public Health Agency of Canada, Inuit Taprit Kanatami, Assembly of First Nations, WHO, the World Health Organization, as well as NCCID and NCCIH. You can also seek information from your community health teams, provincial, territorial, and local health authorities. Nakumik, miigwech, merci, and thank you.